Yeah, good day everyone. Today I would like to discuss about appendix pain, signs you see before it becomes too late. Usually the pain of appendix is towards the belly button to the right lower abdomen. The pain are usually associated with nausea or vomiting, and there will be increase in fever. When the appendix inflammation of appendix is confirmed in the hospital, the best thing is just to remove the appendix as soon as possible. But if you ignore the pain and start taking antibiotics, over the counter antibiotics, over the counter pain relief, before you know it, the symptoms become subsided, but the inflammatory reaction that is going on within the appendix still continues. By the time the appendix becomes so inflamed, it can cause what we call ruptured appendix. The inflamed appendix becomes so swollen, then it's busted into the abdomen. And once it's busted into the abdomen, the complication is what we call diffuse peritonitis, or there will be a diffuse generalized abdominal pain. Instead of the pain localized to the right side of the lower abdomen, it becomes a generalized abdominal pain, and the patient might not even be able to walk or do anything. In that case, thereby leading to an emergency surgery where an X-lab will have to be done, exploratory laparotomy, to see the extent of the damage. And during the procedure, depending on the extent of the damage, it can even lead to amputation of some parts of the intestine. These are some of those complications when a patient ignores an acute appendicitis pain, take over the counter pain relief and antibiotics, then it become complicated by having a ruptured appendix. Ruptured appendix, when you get in, instead of doing a small, even a stab or incision around the right iliac fossa that the patient can even go home that same day or within 24 hours go home, it's going to be an extensive surgery that the patient will be spending something like 3, 4, 5 days, a week, or even 2 weeks, or even more in the hospital. And there might be loss of some part of the intestine. That is amputation to cut some part of the intestine that becomes damaged. There might be addition, there might be a lot of different complications. So it's always best to respond to your appendix pain as soon as possible and let your surgeon attend to you, do a simple appendectomy, appendicectomy. You go on within 24 to 48 hours or that same day, rather than spending more and staying longer in the hospital. God bless you.